Hello everyone, a warm welcome to one and all to this new value-added course on basic life support and advanced cardiac life support. And you will be having four instructors. One will be me, and other three are Mrs. Arya V. Ajit, Mrs. Ashwati Gobi, and Mrs. Rosario Anto. So before moving to the class, just see this picture. This is Mr. Puneet, one of the great powerful actor of Kollywood, recently passed away with massive cardiac arrest. So this is a thinking point that we have to think like, even though there are so many awareness programs, training programs, e-posters, videos about the CPR, about the cardiac arrest, everything is there, and all the persons are knowledgeable. Still, the cardiac arrest happens. So, telling about this person was very healthy as well as was doing workout. So that means the warning signs of this cardiac arrest are little rare. While comparing with the patients who are having cardiac problems as well as any other problems, and even a healthy persons, these two categories are having equal risk to get the cardiac arrest because the cardiac arrest warning signs are less and the risk factors of the cardiac arrest may be hidden in most of us. There is, you can read this statement like the statement which is having limitations. The most common reason many people die from cardiac arrest is because no one nearby knew CPR. That is sometimes a fact, or if they did know it, they didn't actually do it. So sometimes effective CPR are not being delivered, or sometimes there is some limitations that if we know CPR, we are not permitted to do the CPR in that person. Maybe like religious reasons, or maybe cultural reasons, or maybe stigmatized. So there are other reasons also. So looking to some of the statistics, mainly in India, 10% of the death in India is due to sudden cardiac arrest. These statistics data are from research studies. And one other studies which happened in 2020 says that 9,863 cardiac arrest has been occurred outside of hospital. OHCA is out hospital cardiac arrest. So these are the statistics, and just look into some of the history of CPR. When the CPR is invented and who invented? Actually, the CPR is invented by Peter Safar and James Elam. They have invented mouth-to-mouth resuscitation in the year 1956, and in 1957 the United States military adopted these things and started doing it. And actually in 1960 is the year in which CPR is invented by Peter Safar as well as James Elam. Even though the CPR has been invented and we have given training for several persons, this statement is very evident. Despite recent gains, less than 40% of adults receive layperson initiated CPR, and fewer than 12% have an AED applied before emergency medical system arrival. So that means the CPR is being taught, but effective CPR is not being given one way. And other thing is in outside India or in abroad and all, even in the bus stop, even in a critical area, or even in banks or the places which people used to gather, all these area there will be AED, automated external defibrillator. In India, it is not evident in the areas which people gather. That is yet to come. But in other countries, it was there. Still, the AED is not been that much used. Okay, let's move on. There is a chain of survival. This is create all the guidelines of CPR, basic life support and advanced cardiac life support is being developed by American Heart Association. So they have brought upon in-hospital cardiac arrest as well as out-hospital cardiac arrest chain of survival. This is a chain of survival. Inside hospital, a cardiac arrest is being occurred. What we should do? So the first step is early recognition and prevention. We nurses are responsible for the patient who is admitted in the hospital, right? That means we should know what are the risk factors a patient is having when he is in the hospital. For example, in case of patients with heart problems, they are at risk to get cardiac arrest. So we should be very vigilant and we should monitor. So when it is happened, even we use preventive measures as well as even we find it out the risk factors, cardiac arrest happen. What is the next step is activation of emergency response systems. So how to activate this in hospital? We have to call the code blue. And when the code blue is being called, before they arrive, we should start high quality CPR. And if the defibrillator is being available or AED is available, we have to provide shock to the patient. And if shock is being given properly and CPR is being given properly, the patient will come back to life. What we have to give is post cardiac arrest care. We should give that care. And now in this 2020 updates, the AHA has been added recovery. Even though the patient has been recovered from this cardiac arrest, further follow-up also should be done in these patients. And next is out hospital cardiac arrest. When we are witnessing a cardiac arrest is being happen, what is the first step is activation of emergency response system and rest the following. We have to provide a high quality CPR followed by defibrillation if AED is available, and by the time the emergency response system will arrive and they will take over with advanced resuscitation followed by post cardiac arrest care, and this also is ended with recovery phase. That is, after the patient is been recovered, we have to keep strict follow-up. So that is about the chain of survival in hospital cardiac arrest as well as out hospital cardiac arrest. Finally, we have been sometimes mistaken about these two words, heart attack and cardiac arrest. These two are not same. Heart attack means myocardial infarction. So that is due to a blockage or restriction of blood supply to the heart. That is, coronary artery is not able to supply blood, oxygenated blood to the heart, and heart is not able to pump properly. That is been in find it out with symptoms, evident symptoms, even hours or days before it will be shown that you will be knowing about the symptoms. But cardiac arrest is the one which is happened due to the stoppage of or the malfunctioning of the conduction system of the heart. The SNOD is not functioning, immediately stopped. So that will leads to cardiac arrest, and signs and symptoms will occur just moments before cardiac arrest. That is the main difference. And how to take action? Every minute matters. Whether you suspect it's cardiac arrest or a heart attack, we have to call 911. So when this myocardial infarction is been occurring, we have to go with the management of MI. You will be knowing the management. I'm not going to repeat. And when cardiac arrest is being recognized, we will be calling 911 as we done in MI and followed by CPR. That is the actual course we are going to study. So this is just an introduction about the course, and we will go with the course and have a nice time to all of you.